Good afternoon. This series of videos is Healthcare Advocacy, where we address problems in the healthcare system, take actions, and try and make a better system for all of us. I'm Alan Unell. In the description area below will be a hyperlink or a link to the Healthcare Advocacy newsletter, which is the text for today's video. And all of the hyperlinks and graphs and links to articles and action items that I mentioned will be there. Okay, let's get started. Medicaid unwinding. Medicaid was expanded to cover people to 1.4 times the federal poverty limit during the pandemic. Last March, the pandemic was officially ended, and recipients had to re-enroll. That process of removing people no longer eligible for Medicaid through the re-enrollment technique is called unwinding. Now, according to a recent Kaiser Family Foundation, and the link to that analysis is of course in the newsletter, in December of 2023, they did an analysis and found that 13.4 million people lost their Medicaid health insurance. Many of those that lost coverage were children. In the newsletter, you'll see that there's a graph of how many people were removed by state as of December. Number one, leading the pack, was Texas. They disenrolled 1.7 million people. Florida, coming in a close second, disenrolled 1.1 million. Worse yet, 71% of those people that were disenrolled they lost their health insurance for procedural reasons, such as lost or incomplete paperwork. Wait, this gets worse. Of the people that were disenrolled, 2.48 million of them were children, a full 37%. Part of the problem is that even with government subsidies to buy an ACA plan, an Affordable Care Act plan, many of these people who lose their health insurance, they can't afford it because 1.4 times the federal poverty limit is somewhere between $10 and $11 an hour. And you know what? You can't get a place to live for that, let alone eat. So there's just no way. Okay, the expansion of Medicaid has been shown to actually increase state coffers. So I'm switching gears here. If you're looking at it from the state's point of view, because Medicaid, we didn't mention it, but Medicaid is a joint operation between the federal government and the states. It turns out that increasing or expanding Medicaid to 1.4 times the federal poverty limit actually doesn't cost states money. And part of the reason is that when you have more people in the healthcare system, it takes more jobs to do it. And more jobs means more payroll taxes, more state income taxes. It means that people are spending more money, and that means more sales taxes. It goes on and on. Anyway, I've covered it before in other lectures, and if you go to the newsletter, there's a link to an analysis done by the Commonwealth Fund on that subject. Okay, look, this is a horrible situation. People losing health insurance. You know what the answer is. It's universal health care. Then states won't feel obligated to take health care away from 2.5 million children. That'll feel good for everybody. Remember, universal health care has been shown to cost the U.S. far less than what we pay now, according to multiple nonpartisan Congressional Budget Office reports. And back to that newsletter, there is a link to the 2022 report that the CBO, the Budget Office, did that shows that there's a huge positive impact to the economy for having universal health care. So look, while I'm thinking of it, I'm going to remind my member of Congress and my senators that universal health care, like H.R. 3421, provides medical coverage for all of us, costs our country less, increases lifespan, that was in the report, and increases personal income. I didn't mention it, but the increase to personal income was about 11%. Okay, here's the action we can take. Congress is coming back into session. I know they're busy with lots of critical topics like funding the government. So let's remind them that they can improve all of our lives by enacting universal health care. If you go to the newsletter, down at the bottom in the resources section is contact information for pretty much every elected official. Or you can use ResistBot and your cell phone to send an email that I have here. It'll go to your member of Congress and your senators. You just text SIGN, S-I-G-N, PQAHLR on your cell phone, and you send it to 50409. Let me read you the email. I'm your constituent, and I just learned that according to the Kaiser Family Foundation December 2023 report, the number of people removed from Medicaid is now over 13 million, and 71% were removed for paperwork or other procedural errors. That's about 9 million people who ought to have health care. Anyway, 2.5 million of those that were disenrolled were children. Good news, you can fix it by enacting a universal health care system like H.R. 3421. It'll cover all of us cradle to grave, cost the U.S. less, increase lifespan, increase personal spending. My evidence is the CBO report from 2022, and in the email I actually have the link to it. And please read it, or have your staff read it, and then support it. Okay, next topic. Florida, where truth comes to die. The Surgeon General in Florida has decided that the debunked conspiracy theory is a good public policy, and he is so wrong. And this guy's supposed to be a doctor. Florida Surgeon General Joseph Ladapo is calling for an end to using modified RNA vaccines to fight COVID variations because they change people's genetic structure. They do not. Okay, I can't conjecture as to his motive for this Republican disinformation campaign. I don't know why he would say this. He is a doctor, but we have seen that the death rate from COVID skyrocketed in Republican anti-vaccination states far beyond what it is per capita in any other location. I'm not sure what to say about this other than ignore this nonsense. Make sure you get vaccinated. By the way, I just heard that in Oregon, my neighbor state, I live in Washington, flu and COVID cases are up 30%. Get the flu vaccine while you're at it as well. In other vaccine news, where I live in the Pacific Northwest, we had a measles outbreak a few years ago because parents decided that vaccination was dangerous. It isn't. Somehow they forgot that measles can cause death. Let me give you a brief interlude that's not in the newsletter. There was a doctor in England who put forward that falsity. He claimed that I believe it was the measles, mumps, rubella vaccine caused autism. It doesn't. Not only did he lose his medical license for lying to the public, he also got to go to jail. It's just not true. Don't believe it. Anyway, in Suffolk County, the Department of Health in New York is sounding the alarm on now a whooping cough outbreak that's happening throughout the school districts in the region. It detailed this in a press release last Saturday. I'll just quote, "With so many respiratory illnesses currently circulating, some for which there is no treatment, we wanted to make sure that parents know that pertussis," that's whooping cough, "can be treated with antibiotics if you diagnose it early." This is from the Suffolk County Health Commissioner, Dr. Gregson Piggott. He said that in the release. The CDC recommends whooping cough vaccination for all babies and children and preteens and pregnant women. Adults who've never had a whooping cough vaccine should also go get a Tdap shot. You can probably go to your local drugstore and get that. Make sure you talk with your child's doctor. If you have any questions about whooping cough vaccines, get it done. Make sure that you get covered. Okay, a little bit more news. Insulin costs lower for some more people. According to USA Today, and the link will be in the newsletter, a price cap on insulin from one of the three major manufacturers took effect on New Year's Day, giving more Americans with diabetes more affordable treatments. As of January 1st, 2024, Sanofi cut the price of Lantus by 78% and short-acting Apidra by 70%. Excuse me. The price cuts will reduce the cost of the drug for most patients to $35, either through the price caps or with savings programs. Okay, look, it's a good start, but I want you to remember something. If we had universal health care where the government insurance trust took care of all of us and had to pay everybody's prescription bills, we would be negotiating every drug price with every manufacturer. Okay, here's the downside to this amusing story about dropping the price of insulin. This January, it was reported that 500 drugs are being increased in price just this month to counteract the lower negotiated government drug prices on the 10 drugs that are going to take effect in 2026. You know what? They gave a little on those 10 drugs, but here we have 500 more, and they're going to more than make up the difference. Universal healthcare is the answer. Okay, you can like, share, subscribe down below, clicking the appropriate buttons. Go read the newsletter. Go please take the action to let your representatives know that Medicaid is not for fooling around. Okay, thanks so much. We'll talk next time.